So in order to be successful, I believe there are different phases that we need to go through. And the first one is to identify the question. What are we trying to answer to start with? In which use case or which phases are we sitting? And how could we help the program depending on what question they have? I think the communication that we have and the engagement to understand from the modeling perspective how we can provide the support is important. So to be able to refine the questions. And then the second step is about data collation of data, making sure that we've got the data not only to inform the models, but also to try to answer those questions that are there just with the data that it's available. So putting synthesizes or collating all data into one place, and then using all of this data to then simulate the impact of different scenarios, to be able to then have a range of outputs that will be used for the strategies, for formulating those strategies or doing the recommendation that the program will do, not necessarily like a already made solution from the models, but like through thinking between the modeling outputs, the additional evidence, and like depending on the need of the programs. So where I'll start, and I think following up the presentation that we just had from Elizabeth, I think is if we have a question, for instance, being we have a stratification of risk or epidemiological stratification, and we have some ideas of like what interventions we would like to put in place, and the question is where would that lead us? What is the impact of this stratification plan? So modeling can help answering this question by simulating with an understanding of different assumptions where we need to, where these interventions would go or would lead, but also helping us having a broad understanding of how much this would cost, more or less. But if you change the focus, you could also look at from the impact perspective. If you have a target that you want to achieve, modeling can help you understand what is this stratification that would lead you to this target, or at least helping you having some evidence to put this together. And at the same time, having this stratification, trying to minimize the cost at the same time. On the other hand, you could also start with a focus on the cost and say, I have a total amount of money, and what I want to do is I want to have a plan that allows me to maximize the impact, but without overspending the budget that I have. So modeling can also help guide the thinking in those terms. So what we did in Tanzania, in 2016, we were approached by the National Malaria Control Program to help them understand what would be the impact of their current strategy and understanding whether their current strategy would lead them to their target goal, which was at the time and we're talking in 2016, it's easier just to answer without modeling today, but at the time, we were trying to understand whether it was possible to have a prevalence throughout the whole country of less than 1%. So they contacted us, and then we started working together to understand whether we can achieve this target with the current plan. And if not, the second question was, what would be the alternative strategy that would lead us to this goal? So we started the process by collating an awful amount of data that was available to try to answer to these different questions. So that extend from the literature that any information that we can understand from Tanzania in particular, but also going through different surveys that had been done, whether it's community survey, whether it's school survey or clinical surveys, having data from the program, so working where the malaria cases as well as the commodities, and understanding also the knowledge from the different experts. So there's, on one hand, there's data, but there's also like an immense value of discussing with the expert who knows the context, and especially for entomological data, where some data might have been collected, but how do we extend this knowledge, extrapolate? And I think the assumptions needs to really be carefully thought, talking with people who understand the context. So once we had this data collated, the second step was more on our side. So it's to trying to introduce the model to the program. It was important to have this understanding from both sides of like what could the model do and not do, and helping them understand what it is. So there was a lot of a workshop and communication organized to help them go through the model, so that then we can go back and work more on the model side. So what is the model? And I'm just going to go very briefly on this. What the model that we've used in Tanzania is called the Open Malaria. So it's a model developed by the Swiss Tropical and Public Health Institute almost 15 years ago that it started. And originally it was developed to simulate the impact of the vaccine. So now it's been extended to encompass a number of interventions. And what it tries to do, the model is tracking the status of individuals through the life cycle of malaria. So whether the individual is uninfected or infected and then becomes infectious and then sick. So the model has different probabilities that have been informed by data collated from different trials. So the model also accounts for treatment-seeking behavior, and that's calibrated more depending on the settings and on the understanding of the context. And if they access the drugs, then the individual can then either become back susceptible fully or maybe just be uninfected if the drug was not efficacious. So we try to get as much data as we can to be able to inform on the human side. But on the other hand is once the mosquito has bitten on an infected person, then we also consider the mosquito being in different stages. So the mosquito is either feeding, is either resting, laying its egg, or looking for a host to bite. And the reason why we categorize into those different phases is because we also want to understand how the different interventions that we would put in place, whether it's nets or whether it's indoor residual spraying or it's larva control, will affect the cycle and will reduce the transmission at those different stages that then will percolate back into the human. And then this is how we get an understanding of how prevalence could be predicted. Prevalence and burden. So together with this model informing the dynamics of malaria transmission and burden, we put together a framework that is trying to use as much data as possible from the context. And then we try to characterize each of the council that are available, that there are in Tanzania. And for each of those councils, we try to characterize based on intervention coverages, based on case management, transmission intensity, if we knew anything, based on what is the vector composition, what is the seasonality. So as much data as we can to characterize each of those different councils. And then use this data to then inform our model to try to, as I mentioned, calibrate, which is informing the model and try to represent the past trend to make sure that what the model is simulating corresponds to what the data is also telling us. And that then will help us to simulate the future and understand, depending on different scenarios that we want to consider, what would be the different predictions that will then help us to lead to an action. So the model, again, will help to guide the thinking to an actionable decision. So the result that we got at the beginning by just simulating the current national strategic plan at the time led us to prevalence by 2020, which wasn't less than 1% in the whole country. Otherwise, this map would be green everywhere. So what we had is a current strategy that was not leading us to the goal that we were expecting. So the second question was, what do we do then? And then we came up with a suggestion of a very aggressive plan, which the model was suggesting that we put MDA everywhere in the country. Obviously not operationally not, nor financially feasible. And so this plan was not selected. So we started to think about what else could we be thinking of. Could we be thinking of a cost-effective plan, which gives us the most impact for each dollar that we spend there? We had a suggestion, however, this was still not meeting the goals that we had in the NSP. So, although it looks kind of negative outputs, those were really useful actually as advocacy to say we need to revise the strategy that we currently have in Tanzania. We also need to rethink in terms of the goal. Maybe the goals were too ambitious, especially as we were getting closer to the target. So the next step after that is the program went back and started thinking in terms of how to stratify, epidemiologically speaking, with the different indices that they have, with the different sources of data. And then they came up with those 5 strata, which is low, very low, low, moderate, and high cancels, so different depending on their transmission and burden, but they also had the 5th category or 5th strata for the urban area. So then thinking, how can modeling help us to allocate what we need to be doing in each of those different interventions? each of these different strata, sorry. So what we did is we had for each strata very specific sets of scenarios, and I can tell you there was a lot of simulation that was performed for this, to be able to answer this question and for giving some evidence of what could or could not happen. It doesn't mean that it's the answer again, but it just gives some idea, especially as we compare scenarios. If you want more details on exactly what happened, I invite you to go to the session that Fabrizio Molteni will be doing tomorrow afternoon at 4 p.m. So this led to the revision of the malaria strategic plan. So together with other evidence, so other data, with knowledge experts, the outputs of modeling were combined and discussed and reviewed. And so they had a lot of workshops. And at the end of this workshop, there was the revision of the malaria strategic plan with the midterm strategic plan for 2018-2020. In this midterm review, they had for each of the strata an allocation of which intervention should go in each of them. So one might think that this is it, we've done it, we provided support to the update of the NSP, but in reality, it's an iterative process. We've just done one component of it. We've updated the malaria strategic plan, but we can do more. The next step that we're actually supporting now is the development of the global funding application and helping shape the different questions. For instance, an efficient allocation of the funding that they might have, what should they be doing, what given a fixed envelope. But you can also think that as the data is getting stronger and there is improved methodology or improved technologies, we could also rerun this analysis to get finer and finer results.